Right. So this is holding on for people to come in. Brilliant. Hello. Um, brilliant. 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 Thank you very much, guys. Just about a minute and we'll be live. And if any of you want to be in the video link, you can show your video. And of course, I can allow you in, but it's all right if you just want to watch. It's intended to be just about 15 to 30 minutes. And I intend to share the screen to show the presentation slightly. This is an overview that's intended to be presented such as a public education endeavor because we know that knowledge is power and a lot of people have not understood the interventions that are available for tackling this menace and this trouble that is in our hands. Obviously, we do know the world is battling a pandemic, but we do know that there is a secret enemy that is dealing with people aside from the problem that the world is battling with. And there is no gainsay in discussing the fact that hepatitis B has been affecting lives and has been dealing very terribly with so many people. In that light, I think our intervention group has been in the forefront for of fighting for and seeking interventions, and one of which is what I shall be presenting to you at this moment. I'm going to go jump right into the slideshow now, so that you can also participate and see what we're talking about. It is here. I'm going to start that, and you can see all of that. Brilliant. Okay. We will have sessions for discussions, but clearly we're going to be talking about an overview of hepatitis B. The terminology hepatitis B can actually sound very daunting to many people, because so many, if they die from some cirrhosis or anything, there is a lump of information about what hepatitis is. And sometimes the mention of it actually scares people. And there are lots of Chinese whispers about the cures, and a lot of people are making money from it as well. And they go about believing that there is some cure hidden from them, and that the medical world or orthodox medicine doesn't know how to treat this, and so they lie. And a lot of people are falling praise to multinationals selling multivitamins and or going on alternative medicine, and have in doing so lost lots of muscle mass and have suffered many things from many physicians who have half knowledge about this condition, and so have actually led many to trouble to struggle with what is happening. And so this presentation is an overview of hepatitis B, looking at the introduction, causes, in other words, risk factors for transmission, symptoms, and diagnosis, and how do we determine who should be treated and how should the treatment proceed. Hepatitis B is a liver infection caused by a virus also called hepatitis B virus. Now, when this virus infects the body, it causes inflammation of the liver, damaging its structure and function, sometimes leading to cirrhosis and cancer. Now, mark not that word sometimes, because it's not all cases that proceed to cirrhosis or cancer, but we know there's a strong link that this causes cirrhosis and cancer of the liver. The second point is that hepatitis B is spread via blood, semen, or other body fluids. When these fluids enter from a person infected with the virus into the body of someone who is not infected, that's a very simple, important point. The third point is a sexual contact, sharing needles, syringes, or other drug injection equipment, or from mother to baby at birth, are the commonest modes of transmission of hepatitis B. For most people infected, the infection lasts less than 6 months, and that is known as acute infection if it ceases to exist beyond that point. Whereas for others, it goes beyond 6 months, and which can lead to serious life threatening health issues like cirrhosis or liver cancer. I'm afraid that most people in Africa and Asia fall into the latter group. If someone gets the infection in adulthood, there is about 5% chance of progression to chronic infection. Now, this is what is obtainable in Western developed countries. Whereas if one acquired the infection in childhood, which is the case in most of Africa and Asia, then there is about 95% chance of progression to chronicity. Remember again, chronic infection does not mean severity, it's just the length of time. The best way to prevent hepatitis B is to get vaccinated, and that is available. And vaccination provides immunity in almost 100% of cases, and if they complete the series. Let's go on to the transmission modes and risk factors. Hepatitis B is caused by a virus, a tiny germ that is smaller than a bacterium, seen only with the aid of an electron microscope. We're going through 7 points to see those people that are at a risk of transmission, like acquiring the infection. Now, the uh, birth to an infected mother, that is, if a mother was positive before becoming pregnant and or being positive while they're pregnant, there is a high chance of transmitting this infection to their babies. If someone contacts blood from someone with an open sore who is infected, then and then that blood gets into their own bloodstream, then they can get infection as well. And of course, for your information, the transmission risk of hepatitis B is very high, higher than that of HIV and hepatitis C. Exposures to needle sticks or sharp instruments in healthcare workers or in people who inject drugs. Number four is when you share certain items with an infected person that can break the skin or mucous membranes, razor blades, sharps like toothbrushes, and then you're sharing them, then you're at risk of getting infected with hepatitis B virus. Sex with an infected partner. I must note here that a lot of infections in developing country people is actually in childhood. And so this risk is not so robust. It is much more common in the developed world. And I am aware of certain individuals who have had bad marriage outcomes because they discovered one of their partners was infected with hepatitis B, and all they can conclude is that they were unfaithful. This is not correct. And there are very few cases of those who acquire infection in adulthood, and in most instances, they're actually uh, without chronic infection. Injection drug use that involves sharing of needles, syringes, or drug preparation equipment. And then, of course, in the ancient, tattoos and scarifications are done, and then transmission among children playing with each other. Let's go on to symptoms. What are the symptoms? Many times they ask me, okay, what are the symptoms? How do I know I'm infected or not? Now, I'm afraid there is no certain definite symptom uh, for everyone. In fact, not everyone with an acute infection will even have symptoms. If they are present, there are common ones which I will mention. And so let's go on. Now, you look at that. Most chronic infections are diagnosed incidentally and are discovered as part of investigations. If, for example, you go to donate blood in hospital, or you are doing a medical test for a checkup for something else, and then you're found to have a positive blood test. And so most people are surprised that they don't have symptoms, and yet they are told they have infected. So they're getting completely worried. So for those who have symptoms, things like abdominal pain can be a symptom, and something like dark urine, jaundice, that is yellowish change in the color of the eyes or skin for those who are fair skinned. And then looking at temperature, that's fever, nausea or vomiting, and feeling sick, weakness and extreme fatigue, unexplained, when there's loss of appetite or joint pains, and so on. Now, going to the signs, if the liver has been damaged so much and causing a bit of dysfunction of the liver, then there is accumulation of excess fluid in the stomach, in what is known as a pregnant man. So cirrhosis is not only caused by alcohol, as some people mistake this, and so that fluid can accumulate in the abdomen. This is a photo of a man with enlarged breasts because there is altered hormone inactivation by the liver that is damaged, and so it leads to excess breast tissue growth. Here you see a kind of excess abdominal wall muscle, blood vessels. We call that caput medusae. It's not everyone that must have these signs as well. Spider nevi there, and you see jaundice, the yellow eyes in that lady there, and finger clubbing. And you can also have redness of the palms. We call that palmar erythema. And some enlargement of the spleen. Now, this is just the classical textbook descriptions of what one can see when they're examined in hospital. But by the time you wait for this to happen, then of course it's rather too late. You don't want to catch people at this stage of illness, and you don't want to be a victim at this stage of the illness either. So if you wait for these signs to develop, then it's rather too late. Right, how do we make a diagnosis of this? Here we can deal with an algorithm for screening and diagnosis of hepatitis B. Just hang in there for me. So the single test that can confirm the presence of hepatitis B virus in your system is hepatitis B surface antigen test. This is reported as reactive or non-reactive. Reactive means positive, non-reactive means negative. Now, negative tests can go either ways, but if you're found to be negative, you are offered a vaccine, which can be given currently recommended in high risk groups. Now, this is very important because not rolling out vaccination program for adults who are not at risk is almost like a waste. So most vaccination programs are the birth dose vaccine given to young children and to healthcare workers whose jobs are high risk exposure. Now, for those who are positive, you are diagnosed straight on to have hepatitis B. Now, what happens after that is you are evaluated for treatment eligibility. Very important that you are eligible to be commenced on treatment. What am I saying? There are people who are not eligible, whereas some are eligible. Being ineligible does not mean death sentence. Okay, so you need to be monitored either ways. But you are a complete friend of doctors, specialists in liver diseases, by the time you are diagnosed. Here we have kind of a template that describes all the tests that are done. In some countries, these tests are known as the combo test, and that is what is available and can give a battery of information about the disease condition itself and sometimes provides direction as to the next stage in the treatment plan. There are types of serological markers. Antigens are those proteins produced by the virus itself in collaboration with the way it interacts with the body, whereas antibodies are the proteins that the body produces when the virus antigens react with the how the body behaves. And so uh, the way and manner in which these antibodies are produced can define whether you're susceptible to an infection or whether you are a chronic carrier status and or either your chronic active disease and what should be done for you. This table actually describes the interpretation of these markers, and I will spare you to go through all this detail, but it's self-explanatory and has lots of details, and you can ping me a message if you want to understand how to do this. I have produced an app that deals with hepatitis B serology and also a YouTube video that I can actually explain these details and which you can access or request, and I will be able to send the link to you. Right. So how do we treat hepatitis? I know lots of you, one of some of you here are professors and some are doctors and are actually watching this. And it's actually not teaching anyone, but basically to help the public understand the thinking of a doctor and the use of international guidance about how to treat hepatitis B. So there are 3 points here. All patients with chronic hepatitis B and they have clinical evidence of cirrhosis, which can be done, identified by imaging like ultrasound scan or CT scan or liver biopsy, should be treated, whether they have viral load or not, liver function is normal or not, hepatitis B E antigen or not, that they qualify for treatment. That is the international WHO guidance. The second group is that all HIV, hepatitis B co-infected individuals are given treatment that includes a treatment, a drug that deals with hepatitis B as well, whether they have hepatitis B DNA or not. And that's an important point. The third group is recommended for all infants or adults with chronic hepatitis B who do not have clinical evidence of cirrhosis, but there is high viral load. Now, this is a challenge for many people in low income countries. If you have resources and can do the HBV DNA, and it shows that it's 20,000, then you qualify for treatment. If, however, there is in uh, there is cost issues and you don't have viral load testing kits and systems, the WHO has recommended the presence of HBe antigen as one of the evidence of an actively replicating virus, and so a reason to commence treatment. But these are done within the settings where there are specialists who handle the liver conditions. So, what do you do to make sure that patients win? Educate them and prepare them for treatment. Uh, Educate them regarding the substance misuse. Some people continue to drink And I always remember this point that alcohol on top of an inflamed liver is like pouring foil on a burning flame. The same thing with tobacco smoking. It slows healing process and does not augur well for your liver. Adherence counseling regarding taking medicines in order to reduce resistance. One of the medications that used to be used in the past was lamivudine, but of course we do know that a lot of resistance issues has now relegated lamivudine to the background. Nobody uses that internationally at the moment. And so it's important that when you start medications, you do not stop taking your medications, and follow up is important. Discussion on the willingness to commit to lifelong treatment, its cost implications, and follow up monitoring, both on and off treatment. You need to educate on benefits and side effects because the function of the kidney could be compromised when there is tenofovir used. But this is not invariable and is something that can actually change. And so the need for monitoring of your kidney function or the patient's kidney function is very, very relevant. Lifestyle modification is important. We know that there's something known as non-alcoholic fatty liver disease, and this can slow the healing process when you're on treatment. And so you do need to take care of your health and lifestyle, healthy lifestyle living in general. Right. So the treatment options are tenofovir and entecavir. There are other additional drugs that are injection medications like pegylated interferon, but for those above 12 years of age, tenofovir is recommended, and entecavir for children. This is done within a control setting, like I mentioned, because somebody takes responsibility for monitoring and to ensure that the treatment is continued lifelong. There are exceptional cases of those who may be able to stop treatment, but that is also defined within a specialist setting. Congratulations for staying with me all this long. I will invite you to subscribe and consider joining us at future events. And I will ask you to check our website, www.worthy-works.com, and also find my links there. This time I will give for questions and whatever that people may have so that we can actually interact and go on from there. Brilliant. Good. Right. So I'm bringing my friends. So Adamu Samaila, welcome to the event. I need to hear you, Prof. And Adam Dawood. And if you can have any contribution to make, that would be appreciated.
Yes.
Professor Samaila, are you saying something? I can't hear you. No, I can't hear. Okay. Professor Samela, can you check that up later? Let's hear Adam Dawood. You were telling me something a little bit earlier concerning the intervention of the Nigerian government about the management of hepatitis and the plan that's in place.
Yeah. Good evening, all. Am I audible?
Good evening. Yes,
Good.
you are.
Actually, I said this presentation happened to be very timely, especially for us that are Nigeria that have linked up. The Federal Ministry of Health and NASCAP, as at last week, brought a lot of experts together in hepatology, or the hepatologists working with the National Hepatitis Group GIM. NAGIM, experts have been working on the health with our partners, WHO, CHI, and UNICEF, experts that have been working on viral hepatitis came together and we developed the tools that will help us get all viral hepatitis patients in Nigeria. And the tools will be finalized between now and next week so that we distribute them across all hospitals, health facilities, and clinics that are rendering services in medical medicine so that each and every that has viral hepatitis will be traced and tracked, testing to type outcomes. So with this, our proactiveness is going to be synchronized with the aim of actually helping out on viral hepatitis patients. So thank you very much for sharing this discussion with us. It will go a long way and we'll try to have our own data once the tool is rolled out. So thank you very much. And
I think that's brilliant. Those of you who don't know, Dr. Adam Dawood is one of the kingpin and big chaps in the prevention of hepatitis in Nigerian government. And he's speaking, although in his capacity as part of our group, but he represents very, in a big way, what the Nigerian government is trying to do in eliminating hepatitis B viral infection within that country, and I believe by extension in Africa. And you're going to be quite a big link for our intervention efforts. And Professor Adamu Samaila is a professor of medicine and gastroenterology in Aminu Kano University Teaching Hospital in Kano and northern Nigeria. He's been my mentor, colleague, and friend, and he has very extensive experience many of you who would know him, and he's quite a humble man as well. I do hope
in
that
fact, as a
we
matter
could
of
hear
fact,
him.
Professor
We tried to.
Ismaila Adamu, Professor Ismaila Adamu was part of the gurus that were very instrumental to the development of the hepatitis tool.
Brilliant.
So I think I would like you to even mention part of the extensively here to
Okay. Right. So, Professor Samala is having challenges with the way I think his camera his microphone is having a challenge here. But I have a question here to answer. We may get to get his comments in the video when it's eventually posted on our systems. But there's a question here from Dr. Okeme. It's about can patients who are showing symptoms of chronic liver disease such as ascites benefit from tenofovir? Oh, definitely. From the presentation and from the guidelines of the WHO in international guidelines, all patients who have hepatitis B infection and who are either decompensated or compensated have a chance to get some benefit from tenofovir. This is even where either they have any problem, whether they are whatever, it doesn't matter. There has been few reports of cirrhotic livers actually getting better and resolving, although it's challenging, but it's also is possible. It's not impractical that there would be some resolution of the damages that the liver has undergone. Good. Thank you very much. Any other questions? Yes, so Professor Samela has written to say that he has problems with his laptop microphone, and so that is the reason why we have not been able to hear him. But I definitely will take a challenge to have a one-to-one kind of show where Professor Samela will be able to provide some cogent education program that will support the struggles of many people, not only in Nigeria, because as you are aware, Worthy Works medical education is actually global. We're connected to many friends in Australia, New Zealand, United States of America, and globally all over the place. More than 10,000 people on the page. And of course, the Hepatitis Nigeria network is about 14,000 people. And I think we're going further into the global network as well. And so if we continue with the tempo, uh, it is the intention here is community outreach. We want to get across the message, and the WHO should move at the speed at which it moved for the pandemic. And let us see, we should not just give up because hepatitis is killing people. We are struggling with problems in developing countries, and the world should not be quiet on us. Thank you very much for your time. I do not, okay, there's another question here. It's a comment actually. I intend to do a study here in that regard. That's fine. So yes, uh, Dr. Okeme is asking this question. He worked in a rural area of southern Kaduna and Kaduna in Nigeria, and realized that the burden of hepatitis is very high. And in the past 2 weeks, he has lost 5 patients with decompensated chronic liver disease. That is enormous in a private setup. I wish Dr. Okeme comes up on air like my friends, but it's not really coming up there. I would definitely have loved for him to share his experience. Professor Okeme, are you able to come on air or you cannot? If you cannot, that's fine. I understand clearly the struggle, but if you can come on air, I'll invite you into the presentation and you share your experience. But if not, that's fine. We're almost finishing now, and would be the video would be available and comments will be entertained. Brilliant. We still have 9 other people who are in the background. No questions, nothing. You're happy with everything? Right. Okay. So I can see that people were okay. So my friend is coming on now. Let me see. Is right. Is that Arome or Adam Dawood? Sorry. Okay. That's fine. So I think we can stop here if we don't have any further comments. Dr. Dawood, do you want to say one or two, or is that all? Okay, then. Thank you very much, guys. And I will connect with you in some later days. And thank you for coming on short notice. Okay, so Professor Samela made a comment here. Some of the major challenges of managing hepatitis B in Nigeria is access and affordability to reliable HBV DNA, lack of proper follow-up, especially with regards to treatment and monitoring, surveillance for liver cancer and late presentation. This is a big programmatic challenge, Professor Samaila. I agree with you. And it's because, of course, you did know I worked in Jos, and this has not changed. And this is a real challenge. And I think that whether we have the specialists in place, there is this strong traditional belief that people hold dear to their hearts
Yes.
because of the link between herbs and organic, the fact that they believe that if a treatment is organic, there is no toxicity. They believe that it's natural. And with the wake of environmental friendliness, a lot of people deceive themselves to believe that herbs are curative. And so whether you give them the tenofovir or whatever you give them, they still go behind, and some deceitful vendors will tell them that there is cure somewhere. And so that is a problem. So you're battling with that one. And in the second part, therefore, the presence of the exotic diagnostics. HBV DNA, yes, we do know, but HBe antigen could be used in its place. But we know, me and you, Professor Samela, know that most hepatitis B variants in Africa is the HBe antigen negative variants, which is the the non-wild type, and so that is actually a challenge as well. So we depend on the HBV DNA or maybe imaging, which again is a challenge. And healthcare delivery is the problem. We cannot shy away from the poverty line people are struggling with, and so on. So I agree with you that in earnest, a lot of factors have to be put in place. There are false claims of cure on unregulated social media by quacks, very troubling. It's a real challenge, and I believe that this is something that we are coming into where there is the challenge. In other words, staying away from social media cannot help us. We need to fight and say our own, put our own points across as well, and let us struggle with them online. As they see of people who know authentic information will know where to find help. And when they come to us, we're able to, those who listen enough to us will be able to get information that will help them. So I agree with you in Ernest. There's another new message here. Okay, so very good. So I think we're done virtually, and we can go off here now. I think so. Prof, thanks, Prof, for coming through this part. I believe that those points you've noted will be some big time discussions, and it will open up lots of windows. And I believe there's some people who hold dearly to their hearts about the cures, cure claims, and so on. Because one of the questions I get commonly is about is hepatitis B curable? Now that's not a point to look at. I believe that it will be something that we can address on a big event of this nature. And thank you very much for your time and taking your busy evenings and sacrificing your time to come and join us. Thank you. Bye bye. See you again next time.